Dan is going to speak about climate change and its impact on the design professions. And he has produced a white paper that he will be describing today. He is one of our professional visiting scholars and is, like the others who presented the previous 2 days, is doing fantastic stuff. Dan is both a graduate of Texas A&M. He helps us tremendously with various studios and others, as always volunteering and participating. And he is a member of the firm HDR. So I don't see Bill's name on the screen. Dan, if you're ready, feel free to, oh, well, wait a minute. I'm sorry. Jorge, we've been waiting for more people to sign up so that you could speak to a larger audience. So Jorge Vanegas, Dean of the College of Architecture, is going to greet us and welcome you to the current HIAC meeting. Thank you, Jorge.
Almost good afternoon, but howdy, because we're in Aguiland. It is a pleasure always to spend a few minutes with you. I know you have a busy schedule, but before I talk about the welcome, I want to very openly make you all aware, if it has not been already shared, and I want to be the one congratulating. Shumei Xu is a very recognized scholar associated with our Center for Health Systems and Design for many, many years. And she has been honored as a 2021 Presidential Impact Fellow. There have only been 5 classes of that for this, and she's joining 75 colleagues out of thousands that we have here that are recognized with a prestigious Scholarly Impact Award. And this is given to a rising star in their respective fields. Of course, in the case of Shumei, she's not a rising star. She has been a star for quite about several years, and I have had the pleasure of working with her. But why I want to say what I want to say is because she embodies the university's commitment to advancing knowledge through transformational learning, discovery, innovation, and impact for Texas and the world. And I think the Center for Health Systems and Design, with all of its fellows and all of the companies that support our efforts, and all of the faculty that participate in our efforts, and all of the students that benefit from our efforts, is tremendously poised to embody this award as well. So I want to start by saying, Shumei, congratulations.
Thank you, Jorge. I'm lucky to have everyone around me, you know, it's always teamwork, yeah.
So my welcome is going to be twofold. We are on a time of significant change at Texas A&M. I have had a chance to talk to several of our advisory boards, including the one at the college, including the one in construction, and several others. We don't know what the future is going to be yet. We have just, and I don't know if that's part of your agenda, Ray and Kirk, but there are a lot of impacts on Texas A&M in terms of the restructuring of the upper administration and the restructuring of some of the colleges around that. So the not so good news is that we don't know exactly where we're going to be. There are some recommendations that have a very direct impact on our college. There are recommendations that do not acknowledge the existence of the centers and the institutes, which is a little bit troubling for me, especially with what the Center for Health Systems and Design represents. And there are other things that have been open for feedback from people. So one of the things that I encourage all our faculty, I have encouraged all our industry partners, that I have encouraged anybody that has graduated from our college, is to express their independent views of their reaction to that report. I know that I am not attacking in any way what is being proposed, but I can tell you that everything comes with pluses or minuses. But what unites everything is that change is inevitable, and we have a chance to make the best out of the changes that are looming in the horizon and going at us at full speed ahead, like a train on a track. So having said that, I want to brag a little bit about why our Center for Health Systems and Design depends so much on industry. The move in many industries has been to collaborate with others. And we have a center that is a model for collaboration across all colleges in their current state before any changes may be done. In that collaboration, the center has benefited from a big initiative that A&M has done in the past, which became one of the grand challenges, which was the whole issue of One Health. One Health is a global effort to unite the health of humans, the health of animals, and even the health of ecosystems from an agricultural and food production perspective. And we have been at the forefront of that. We have collaborated with medicine. We are a joint venture with medicine. We have collaborated with veterinary medicine and biomedical sciences while it's still there, and other kind of collaborations. And your circle of deans certainly sets a tone for reaching out to every single unit at the university, whatever number of units may remain. So in saying that, I want to say thank you and welcome to the HIAC meeting right now, Health Industry Advisory Council. And I know that you represent where our students go and make a contribution because you hire our students. You are the platform by which other leaders emerge. Our faculty have been tremendously devoted, not only to the health science perspective, the health systems perspective, but the architecture for health perspective, because without us, who designs the facilities for wellness, the facilities for healthcare, the facilities for rehab long-term, the facilities to just have an urban setting that promotes healthy living, homes that are healthy in themselves. And with the change in technologies of Industry 4.0, Internet of Things, and all kinds of things, we are poised, especially in a post-pandemic arena, to really make a difference and uphold what A&M stands for. And that is a tier 1 research institution that happens to have the designation of land grant, sea grant, and space grant. And our college has been working in all 3 of those fronts completely over almost 40 years. The college was founded 50 years ago, a little bit over 50 years ago, but it has a tremendous history of engagement and reaching out to communities. So with that, I know I have been kept abreast by Ray. I keep prodding him with all kinds of crazy ideas. He knows that I keep on doing that. But I'm here just to say welcome. I hope you have a great meeting. You're in great hands like always. Thank you, Cynthia, for all the organization. And to each one of you for connecting virtually, which is really part of the new normal, where it doesn't matter where we are joined by what I have always described as a fellowship of consistent shared values and mutual benefit to all in a complete transdisciplinary environment that has only one mission, and that mission is a quality of life for people. And the Center for Health Systems and Design is at the tip of the spear of that quality of life. But that is complemented by the quality of place in the built, in the natural, and the virtual environment. And that's why visualization also plays an integral role in what we do. So with that, what do? We enable human endeavor. And to enable human endeavor, it begins with wellness, health, public health, and all the things that you all represent. So with that, bienvenidos, welcome, and I hope you have a very productive meeting. If anybody wants to chat, I'm always available for private emails, conversations, telephone calls, but I am a total champion and advocate for what we have represented for over 50 years. And I think that we are at a crossroads where what we have done is going to speak on its own without having to convince anyone. And you represent part of that legacy. And not only a legacy, but a foundation for the future. So back to you, Kirk. Back to you, Ray. Thank you. And I shall see you soon.
Thank you, Jorge.
Thank you, Jorge.
All right.
Thank you for your support of the center. We are grateful for your being a champion for us. So
Thank you, Kirk.
thanks,
And
everybody.
I have to run to another one, so my apologies. I would love to hear your conversations, but I'm sure that Ray and Kirk can fill me in. So, ciao.
Will do. Thank you, Jorge. So I introduced Dan before some of you got on. Dan is one of our professional visiting scholars. This is a program that's only been in place for a little more than a year, and it sort of struggled around the issue of COVID. But we are very excited by the connection that we're making with firms and their researchers. The ability to have access to the full capability of the Texas A&M library system is something that is extraordinary for a firm. And so we are delighted to have Dan today to share his white paper and to sort of give an example of what some of our visiting scholars are able to do as they connect with us here at College Station. Take it away, Dan.
All right. Well, thanks everybody for being on today. This is like new territory. Like I said, I'm not a researcher, but it's been really great for me to have this opportunity to kind of dive into the academic aspect of writing white papers and really kind of uncovering what climate change and its impact on the built environment and for healthcare. Bill and I have been working on this, I think, for the last year. And I don't know if he's on right now, but he can jump in and chime in when he gets on. Let me go to the next slide. I'm going to apologize before the wordiness of my slides. We've completed the white paper. We're probably about 95% complete. So I'm going to kind of give a high level overview of the paper and what the paper consists of. But the problem statement for the paper was really to look at there is a big disconnect between our hospitals' duties to deliver wellness to the patient and community while overlooking their impact on carbon emissions into the environment. The objective is to really look at those impacts from a design standpoint and from a how do we reduce the carbon. You can go to the next slide. And feel free to jump in and ask questions. I have no problem with that as we move through the presentation. The impacts are really looking at the positive carbon hospital on the patient care and a carbon positive hospital on the healthcare design and how as designers we can impact that. One of the things that we uncovered is this relationship between our healthcare professionals actually acknowledging that there's a correlation between our built environment and public health, and really understanding that they do have an impact on the environment, and we are really not addressing that. But we as design professionals are catalysts to really inform and to educate and to show that the healthcare facilities that we're building and developing do impact a great deal of the environment and have a huge impact on carbon emissions. And so those are the two things that we'll kind of highlight as we move through the paper. You can go to the next slide. So as I mentioned, we've kind of completed the paper, and this is kind of an outline of where we are we've got 6 kind of paragraphs or 6 sections within our paper. Climate change and its impacts, hospital design, the era of climate change, defining carbon positive, and designing the carbon positive hospital. What is carbon positive or carbon neutral? And we'll get into that a little bit more. And then, what are their impacts on our patient care and healthcare design? And then how do we change the way we think as designers as we are approaching our new world that we live in as it pertains to climate change? Go to the next slide. So I always start out with this quote. This is one of my mantras, or one of the bedrock of what I believe in as we look at healthcare design. You know, if we can create health systems that actually are capable of keeping people healthy, both mind and body, and I always add spirit because it's Christopher Alexander's quote, but I kind of add the spirit in there. But it emphasizes on health and not sickness. It is therefore to be physically decentralized so that it is close as possible to people's everyday activity. So, you know, hospitals and healthcare and wellness centers have to be within our everyday activities so that we're aware of it, and it influences a lifestyle of wellness and not just sick care. And it must, like it says, it must encourage people to do daily practices and lead to health. And so as we were starting to look at climate change and how our healthcare facilities impact climate change, the question is that should hospitals be concerned with that? Because there's some factors that will overlay with design and cost that will impact not only how they deliver care, but their bottom line as they're trying to meet their patients' needs and the fiscal responsibility of their system. So go to the next slide. So the climate change and its impacts, you know, what are some of the impacts of the climate change on our healthcare systems? There's a frequent of extreme events. We're seeing that across the world, you know, hurricanes, floods, the pandemic. So there's these extreme events that impact our facilities and impact the way we deliver care. You know, healthcare systems are a part of the problem, and we have to define that. You know, we have to acknowledge that the healthcare systems are a part of the problem, and they're a part of the solution of creating those healthy environments. And how do we design these facilities that are going to be part of the solutions? And that's our challenge as design professionals. You know, how do we treat the victims of climate change as they enter the facilities, and then we do no harm to the areas that we are designing? And it's a design mindset. We've got to change our thinking in the way that we design these facilities. So it's a forefront of our design approach. It's not an afterthought, oh, we got to be green, or we need to think about how we're going to impact our environment at the end, but it's a part of our design process as we move forward. Go to the next slide. And that's the first section of our of the paper. Like I said, hospital design in the era of climate change. I mean, it's a global problem that we are all facing with, and it's something that we cannot turn our back to. We have to understand how we're going to design these facilities with climate focus. We've got to focus on improving patient experience, reducing the per capita cost of healthcare, and improving healthcare populations, and keeping in mind that we've got to change the way that we practice so that it does not impact the climate. Next slide. And I'm open for questions. I mean, it's, you know, anybody that want to jump in and ask questions, I know feel free. So one of the things that we really started to wrestle with in this paper and understanding what carbon neutral is and carbon positive, and really understanding, and I had to get my head wrapped around the whole carbon emissions and understanding what that means. You know, the carbon neutral is a facility that must remove as much carbon from its atmosphere as it adds to it. It's a reduction in emissions. So we have to remove, if you emit a certain percentage of carbon, you have to remove that percentage and more to be carbon neutral. Carbon positive, which is like kind of the North Star where we're trying to achieve, is to be net carbon emissions, emit very little carbon over the life cycle of the facility. And that's key to really talk about. It's not just as the facility is in operations, but from the beginning of design, construction, and to the quote end of life of our facilities, and how much are we emitting over the time and the life cycle of the facility. Net positive benchmarks must be talked about in early design. I mean, what are some of those benchmarks that we're going to help us reduce carbon emissions as we're looking from a design standpoint? And then helping our systems to develop a hierarchy to achieve this. And we know that achieving net zero emissions is going to be a huge impact on the way the hospitals deliver care and are financially responsible, because we're seeing in our facilities and our systems that we're having to do less with more. And so this is we don't want this to burden our facilities, but we also have to understand that it's making a big impact on reducing carbon emissions in our environment. I'll stop there. Any questions? Any thoughts?
It's a
All right.
good thing telling us, Dan.
Okay. All right. So the next slide is the section 3 of our paper, and it's the future healthcare design and carbon positive. And then we talked about carbon positive and carbon neutral, but I mean, we've got to be bold. We've got to create bold design interventions that allow us to create facilities that are reducing emissions. You know, we've got to have efficient buildings, efficient systems, natural MEP systems that allow us to exchange air. You know, looking at how do we reduce the renewable energy, and how do we not reduce renewable energy, but reduce the energy consumption within the facilities. We got to look at renewable energy strategies, and how do we give back. If we have a central utility plant that's producing energy within our facility, how do we use that central, the unused energy in the communities, and how do we give that back to our communities? How do we use low energy site planning, understanding water, environmental constraints, adding the trees and green roofs to involve our communities within the facility development and enhancing the climate that we impact in our communities. And then developing a comprehensive strategy, understanding a holistic approach within planning our facilities. You know, like I mentioned, this has to be at the forefront of our design. When we're designing facilities and we're in those visioning sessions, these are some of the issues that we've got to bring up at the very beginning, because not only does it impact the environment, but it also impacts the way we produce and the way that we deliver our project as we start to look at our MEP strategies over time and how that impacts the cost of the facility. We'll go to the next question or the next slide. The future of healthcare design and carbon positive, this is the same topic, but we've got to look at the economical impact and considerations of life cycle, energy use, and cost of the facility, and how do we set examples and standards within our community. We've also got to ensure that the public well-being, the public health, economic, social equity, and access to quality care, that the creating a carbon positive or carbon neutral hospital doesn't affect the ultimate goal of our facilities, and that is public health and access to care and patient and family access, and how we involve those in the process. Continue. You know, I keep reiterating this, is that we've got to accept that the climate change is going to impact the way that we deliver our projects. And I think that's the discussion, and I think that's one of the things that we've learned that I've learned within developing this this paper, is that we understand that it is a huge ask for our facilities to think about becoming positive, not carbon positive or positive neutral. And so we're gonna have to really help them understand what that means. You know, understanding the things that it's going to impact our communities. You know, as the determinants of our community, growing foods, reducing site and parking. I mean, the amount of asphalt and concrete that we're building on these facilities, and making sure that we infuse green spaces, understanding how we're going to lower the cost of our facilities, and what are some of the strategies that we look at to lower cost. You know, native landscaping, expanding telehealth. You know, our facilities going to get smaller because we're going to go to more telehealth approach in healthcare delivery. Are we going to see smaller micro hospitals, and how are those micro hospitals being integrated into the carbon emissions within the community and cities?
Hey,
Reduce. Go ahead.
So I do have a question, and I'm going to take advantage of
Okay, awesome.
of the invitation that you gave all of us just to dive in with questions and so on. And maybe this will allow you a moment to breathe too, because you're moving really well. So pardon me, please, for breaking your stride. So from the very start of your slide presentation, which again, thank you very much for doing this, and it's impressive to see the battery of research that you've gone into developing, and we haven't even seen it all just yet. So again, pardon me for breaking your stride, but in listening to you and all the things that you're talking about relative to being carbon positive versus being carbon neutral, all the things that we're doing from a design perspective with regard to programming our hospitals from the ground up. We're talking about greenfield conditions and so on. I now look at everything now from the perspective of, all right, so what about everything that we have right now? So I come up with a list, and it may seem a little hokey, but as I'm listening to you, I come up with this list that all happen to start with the letter E. So pardon me for being a little hokey here, but I'm going to run through that list real quickly.
Oh, that's fine.
Because it also gleans from some of the terminology that you were using or some of the inferences. So experience, energy, excess, environmental systems, engineering, existing conditions, education, and the executive suite. And I use executive suite because I'm CEO doesn't start with the letter E. But when I look at that list, the two common denominators here of what I'll consider to be the critical success factors are the engineering and the education.
Mm-hmm.
And so, and hopefully you dive into that a little bit more as you go into your white paper, but I'd like to know, where do we engage the education side? And I'm not talking about the colleges and universities, though that is very important. I'm talking about the C-suite. I'm talking about those who are actually paying for what we're trying to espouse, paying for what we're trying to recommend and advocate for, but also the engineers. Where are they in this conversation, and why are they not amongst us in this very dialogue that we're having in HIAC? So I just throw that out there. This is something to nibble on. I don't have answers. It's more questions, if you will. So I leave it right there.
Yeah, I think you bring up a great point, and Bill and I talked about this after. Just doing the research, this has been a catalyst, and you've summarized it really well. You want to be a part of the team, you can jump on. We can work through that. But education is going to be key to, and you hit it right on the head with the C-suite. We've got a team that I'm working on trying to pull together some of the leaders in Dallas, some of the CEOs of the major systems here, and just kind of throw this out here and first of all understand their understanding of their emissions and being carbon neutral or carbon positive. And then I think it's one of the key success factors that I think that we're going to see, and you bring it up, is really getting our engineers involved, because it all boils down to carbon emissions and energy consumption. I mean, from a design standpoint, we've got to reduce our energy consumption, and hospitals are major energy hogs. And they produce a lot of waste and a lot of energy, and they use a lot of energy. And so those are the two, I think, from a design strategy, those are the two things that we're gonna have to hit hard to understand what that looks like. And our engineers are going to have to be innovative, and we're going to have to be innovative in order to accomplish this. A great point. I mean, I think you hit it on the head. Does that answer your question? I know you.
Yeah, you did. I mean, here again, I think that you're setting the table for greater discussion that we need to have.
Right.
So let me stop there, and let me allow you to keep on going, because I know that I'll have many more questions, and we can probably talk all day long, which I know we don't have that kind of time. So thank you very much.
Let you know, this is Bill from the beautiful School of Public Health here at Texas A&M. We do intend to try to broaden the membership of HIAC to include the health care owners and operators, physicians, as well as the building engineers that we're also dependent on to complete the team. We do recognize that it's a multidiscipline moving forward more than ever before. And it begs the question I asked yesterday, I think, a little bit about how are we going to manage all this change? Who's going to manage it?
Right.
Is it a government action? Is it the private market? Is it a combination? or is it something completely new as we look at this huge potential sea change that's going to take place?
All right.
Agreed.
You can go to the next slide. I think I got a couple more slides. And we've kind of touched on this a little bit, as and I mentioned it's all about lower energy, consumption, some of the design approaches and impacts on patient care is, how do we shorten the length of stays? One of the things that we were looking at is how do we design a facility that, these facilities run 24/7, 365. And so how do we look at, and this goes back to the engineering, how do we develop these smart buildings so that over time, or 24 hours, the building understands how to use less energy, and really is a very efficient approach to the usage of the building. So the ER is full power, full energy, but the back of the house parts of the hospital are kind of shutting down. So those are some of the strategies that we're going to have to look at to reduce the energy consumption. And then how do we start to look at our waste and getting waste off of out of our facilities? We're seeing that a lot of the waste is being picked up and moved. Back 20, 30 years ago, you had incinerators on the campus that you were taking care of the waste on campus, and you weren't using energy and trucks to move waste off of the facility. So those are some of the design thoughts or solutions that we'll be looking at as we start to do our impact on patient care. You can go to the next slide. Bill, you can jump in. I think we had kind of the engineering and education is.
Yeah, one of the things that sort of popped up when we were talking about that was, well, maybe we need to go back to incinerating medical waste and trash on site, so we're not hauling it all over the place. Can we get EPA to understand that times have changed, and the technology can probably do a better, faster, cleaner job if we're not transporting it all over. It may be a silly question, but I think to find the nugget, we're going to have to ask a lot of silly questions, and in hopes that we'll find one that feels good.
And I don't think there's going to be one solution that fits all. You have the tertiary major systems that are huge campuses, and they're going to have to understand how they're going to reduce the emissions all the way down to your micro hospital, to where it's 8 to 12 bed facility, and still have the same approach to how do we reduce emissions for those. So there's going to be different solutions, and that's where we go back into our engineering partners and our CEOs and really have those heart-to-heart conversations about how we're going to accomplish that. But I think if you go to the next slide, I think the essence of what I've learned on this paper, and Bill, you can talk about this, is this paper is really a catalyst of the conversation. The conversation is just starting, and I think it's something that we have to address in our design approach to designing facilities for the future. We have to understand how we're going to reduce energy consumption for our facilities. You can go to the next, kind of talked about that. You can go to the next slide. And so the big questions that we came up with, and some of the things that we found out is, our healthcare industry really is a contributor to climate change. And if you look at this statistic, 20,000 premature deaths that are linked to climate change, so it is affecting our society, it's affecting our community, and it's affecting the way that we deliver care from now into the future. And we got to really start thinking about that. You can go to the next slide really quick. So I think this is Bill's quote, and I really enjoyed this quote. In his view, man escaped the prison in which all other life was held because he could apply intelligence and the will to his environment and bend it. And so this goes back to really understanding that we have, as design professionals, we have a calling to understand how we can impact the way we design our healthcare facilities to reduce emissions and to create a carbon positive or carbon zero or net zero facility. And then I'm just going to open it up for questions. There's a lot more detail into the paper that I didn't go into, and we will have it ready for circulation in about a week.
But it's mostly healthcare office. We did Stanford replacement,
Go ahead. I can't hear you.
and now we're doing it. So it's really geared up.
And thank you for a terrific presentation. A lot of challenge built in there. I'm going to start off the questioning. What do you see as the principal barriers to stepping up to take these things on?
As a design professional or as a healthcare system? And I think it's.
Give it a go either way.
I think the biggest. I think in my mind, I think the biggest hurdle is really there's a financial implication to this that hospitals are going to have to embrace, and it's going to be a change in philosophy of how they run their facilities to deliver care. And I think that in my mind, and Bill, you can jump in, that's probably the biggest hurdle because we see it. I've got a slide in here that talks about the LEAD program and creating, gold, platinum, and silver. And we thought that would be, that would take off as and be part of that a major impact in reducing, becoming more sustainable. And it hasn't taken off as well as we thought it was going to take off because there was a reluctancy to pay for the evaluation. There was a reluctancy to understand and accept the cost that it's going to take to create these sustainable buildings. Go ahead.
I agree with Dan. I think the biggest hurdle is going to be financial. I mean, we're already fighting the battle over the high cost of healthcare and healthcare facilities. So I think we're going to have to learn more about couching it in terms of what we're saving and what the value of the savings are, both in lives and potential income that's lost there to, just making it less expensive to build again.
Right, and the life cycle cost of the facility. I mean, we're going to have to couch it like this is really going to help, the longevity of your facility. We have to look at it 20, 30, 50 years.
Yeah, and we talked about heuristics. I mean, we do an awful lot of planning based on what we did before. And I think what we need to look at is, well, let's plan for the future. Let's plan that the data that's coming in that says, in one instance, that 60% of the hospital admissions aren't really necessary. So let's stop designing and planning for all those beds that spend most of their time being empty. Apparently, I mean, we need to verify that. We can't just operate on that assumption. So I think we're going to really see some major redefinitions of what it means to be a healthcare facility.
Mm-hmm.
So let's open it up for questions from the audience. This is a big challenge for us.
I have a question. This is Jason Harper from Perkins Eastman. Do you see the direction that our sort of code requirements are going, kind of being at cross purposes with the need to reduce facility cost and energy costs in our facilities? I just doing work internationally, where there is more of a culture of natural ventilation and multi-bedded rooms in many countries. It seems like those are strategies that can reduce facility costs and make the care more affordable. I think we're struggling in the U.S. with the extreme cost of the new hospital facilities, leaving much of the system sort of unable to afford its own modernization, and it's becoming a problem or a factor, I think, in the cost of care generally.
Yeah, I think you bring up some really good points about our international systems and how they approach the delivery of care and that patient experience. We just there's a project out on the street right now that's talking about really renovating a major facility, and 90% of the project is upgrading all their MEP systems. So, that in itself, the lifespan of that building is 30, 40 years. And now we're not tearing the building down. We're, renovating and upgrading their MEP and structural systems. And so, you bring up a good point is like, how do we look at reducing the footprints and still maintaining the delivery of care that, that we expect, from that patient experience. So I think that's going to be the big challenge. It's amazing that we're talking about, senior private rooms, and we've had, the last 20 years of pushing the private room, and now we're talking about if we reduce our footprint, part of that is, having our warded and the semi-private room, or, so it's a good conversation. Thanks.
Yeah, I think it's led to
that, but I mean.
Yeah, I mean, maybe it's more of a comment, but I think it has led to a situation where only the most well-to-do hospitals or systems can afford to build all new single bed bed towers, and many of the community hospitals out there, perhaps serving poorer areas of the country are suffering in older aged facilities without the ability to upgrade.
All right.
Well, I do think FGI and others need to be brought into the discussion in a big way.
Yep.
To one, understand what's coming down the pike along their thinking, and how do we adjust our thinking to the new reality, and just I don't know that we move away from those. That may be absolutely the right answer for us.
Well, I think our FGI I think our guidelines and our codes have to have this lens overlaid, understanding how do we reduce the energy consumption, and then how do we reduce the footprints that we're building. And that's going to be really understanding an operational approach to the facility. So how can we do less, more with less approach? And not only, that's going to impact our carbon footprint,
Yeah. I think we need to bring CMS in a formal way into the discussion,
right.
So that they understand the impact of the decisions they make on facilities.
Right.
I think half the decisions they make, they have no thought process to include the implications for facilities.
Thanks, Sean.
Yeah, I think also, we have to take a stand. We have to, we have to have the courage to take a stand with our clients also, because it's actually written into our code of ethics and what we're required to do as architects. So,
Right.
Well, and I think we need, as architects, learn to accept the leadership role in doing this and the risk associated with it. It's something we tend to avoid as architects, but I think that this is an opportunity to pick it up.
And hi, Dan, this is Lu, and I really enjoy your presentation. And actually, I read your white paper before joining the meeting. Your white paper was on Bill's desk, so I think you just maybe just covered a full of what your white paper just stated. You have done a lot, and then. I would suggest, maybe you and Bill can further develop that to submit that to Kirk's journal or other journals. That would be really good opinion type of paper to be published.
Okay.
Yeah.
Yeah, we have a lot in our paper. I mean, and to distill it down into, I was struggling with it. That's why I was talking really fast.
Well, we also have a section that's not in here at all on the economic impacts.
Right.
Of it and the likely consequences to the architects, and the business world.
Right.
Maybe Kirk can, talk about if your journal, Kirk, can publish the really short and maybe, longer opinion type of paper and or white papers like that, because we have a lot of architects, designers here. So.
Sipang is referring to the Herd Journal. I'm one of the editors. And yes, our journal would be delighted to have strong opinion pieces that are properly cited and so on. It doesn't have to be about a research study. Opinion pieces are important. It could either be the full-blown long form as an opinion piece, or it could be the shorter form as a letter to the editors, but we would welcome it. We are closing in on the end here. This has been a great conversation. And I applaud everybody for your sort of patience with us. We will be transferring over to the lecture series, and Cynthia knows how that is done. I don't know that I have to push any buttons or anything, but you should all be transferring over to the lecture series, which will take place in a few minutes. I think the speakers today are from RTKL, Callison RTKL. And look forward to everybody going. There is in the Cynthia has put the Zoom address for the lecture into the chat. I think if everything works right, you can open your chat. You can click on that link and it will take you directly to the lecture, which starts in about 10 minutes.
That's correct, and you should be able to go straight to the meeting, but Zipang did include the meeting ID and the passcode just in case something like that pops up.
Good, so we have a few minutes left. Are there any other questions that anybody would like to put on the table? I see that we have Zach Rowley, who is the president of SHEA for this year, our Student Health Student Health Environments Association president, and we're always glad to see students participating in these conversations. And I see George Mann is on the screen. He has been absolutely fundamental in terms of preparing the lecture series, not just this year, but for several years past and for the times going forward. So I would simply thank all of you for checking in today. If you also checked in on Wednesday or Thursday or both, we are delighted that in this sort of COVID time that we are able to use Zoom to sort of increase the numbers of people that get to participate in these HIAC sessions. I see Ray is raising his hand, and Bill may have raised his hand. Go ahead, Ray.
Thanks, Kirk. Question for Dan and Bill. Any of us who have practiced are familiar with kind of clever conversation turners, working with clients and coming up with things like delivery time, scope of project, and budget, and telling the clients you get to choose 2 out of the 3, but you can't choose all 3, and we change what those 3 things are on occasion when it suits the argument. And in listening to this, I found myself just wondering if sometimes these conversations involve the guidelines for building a project in health and impact on the environment and cost, and you get to choose 2 out of the 3, but you don't get to choose all 3. Are we entering that conversation where you can spend this much money to fix the environment, but it's going to have an impact on the kind of building you get. Or you're going to build the building that meets the codes and it's going to cost this much, but you can't adjust exactly how it impacts the environment. Or do you find that we are entering an era where with these three, we're trying really hard to manage all three at the same time? How are we doing on that? What are you hearing from your clients?
Well, I mean, I think your last point, I think we are trying to manage all three of those things, but I know our clients are going to default if it impacts their delivery of care and their revenue stream. And I think that's we as designers have got to show that it's not going to be a big impact on that. And I think that's where the challenge lies, is like, how do we look at our building materials? How do we look at the life cycle costs? How do we look at our MEP strategies to reduce admissions? And how do we look at it at almost a cost neutral? And then, I mean, I'm almost looking at like cost neutral, medium to high. And then they're going to make a decision on how much they want to spend on that. Because like you said, it's going to come down to dollars. But I think as a design professional, we have to bring that to the forefront. And like Bill said, we have to be champions of that. But we also have to prove it from a cost standpoint that it's not going to impact their bottom line. Or if it is going to impact their bottom line, what's that impact? And I don't know if we have that information to really tell them that impact yet. That's just my, what I've learned and what I've read.
Because I think these budgets are going to be really driven by reimbursement more than ever before.
Right.
I just see it from a political world. There's going to be tremendous pressure to reduce the cost of healthcare. At least.
Yeah, but there's also a disconnect between first cost versus a long-term operation cost, right? And we're under pressure to reduce first costs, from facility managers.
Right.
But it's kind of penny wise, pound foolish when you look at the long-term, benefit of energy savings. And that's just the bottom line part of it, let alone the environmental impact part of it, the external costs of all that carbon pollution.
Right.
So somehow, like, the conversation has to get as high as possible in the C-suite, to overcome the kind of blinders that sometimes our facility clients have, which is just based on looking at reducing first costs and the budgets for their projects.
Thanks.
So any last questions? We got about 6 minutes left. Let's call it 5 so that you've got time to make the transition across. If nobody else has any questions, let's just thank Dan for a terrific presentation and his colleague Bill for working together to produce this. I do encourage you guys to submit to a journal. My own journal would be happy to publish this material. I think it's important that it be broadcast to a wide and great audience. Our audience for our journal is international, so spreading this story on an international basis is potentially a good thing. We appreciate what you have done, and want to thank everybody else who has signed up and attended either today or either of the last 2 days. We're experimenting in terms of how to do new forms of the HIAC meetings to respond to people's concerns about travel and being in crowded rooms and so forth. And I think one of the lessons is we may be reaching more people through the virtual connection than we do if you've got to get in your car and drive 3 or 4 hours to get to Couch Station.